Hello, everyone. My name is Miguel Martinez, and I am an undergraduate student at the University of Maryland studying biocomputational engineering. I'm here to share some insights from my recent work on leveraging machine learning techniques to enhance the prognostic value of MRI imaging in glioblastoma treatment. Now, this work not only advances our understanding of this aggressive cancer, but it also opens the door to more personalized and effective patient care strategies. Glioblastoma multiforme, or GBM, is an aggressive form of brain cancer, typically characterized by rapid growth and, unfortunately, a high potential for recurrence. Now, despite advancements made in neuro-oncology, the average patient prognosis remains poor, with limited treatment options available. Now, with that, magnetic resonance imaging, or MRI, is a critical tool in the diagnosis and monitoring of GBM. And this leads us to our objective: to perform MRI imaging analysis of a small sample of 31 GBM patients and explore how extracted feature data combined with advanced data analysis techniques can contribute to a more personalized individual care. By applying machine learning models to MRI data, this research aims to develop predictive models that can assist in survival analysis, potentially leading to more targeted and effective treatment strategies. The study also investigates the impact of combining MRI-derived features with clinical data, such as age, sex, and genetic markers, on the accuracy of survival predictions, with the ultimate goal of enhancing patient outcomes through precision medicine. Now, the purpose of feature extraction is to quantitatively describe the tumor's heterogeneity, just how distinct it is, which is crucial for understanding tumor behavior and potential individual treatment responses. To do this, we utilized the Radiomics library, which is built into Python, and extracted 107 distinct features from the scans. And these features include various statistical, shape, and textural parameters. Following this, we standardized the data to have a mean of 0 and a standard deviation of 1. Now, this process is important to remove any bias due to different scales of measurement. And lastly, we scaled the data. We took the standardized data and scaled it to a range of 0 to 1. Now, this facilitates a more uniform analysis and compatibility with different machine learning algorithms. Principal component analysis, or PCA, is a form of what's called dimensionality reduction and is critical for simplifying complex, high-dimensional data like MRI features. It reduces the number of variables overall, making analysis more manageable and interpretable while retaining essential information. Now, by plotting the cumulative explained variance on a scree plot, PCA helps in determining the number of components necessary to capture a significant portion of the data's variability. Now, this method balances information retention with computational efficiency. Implementing PCA reduced the original number of features to only 8 principal components. Now, this choice was based on the ability of these components to capture 95% of the data variance, providing a comprehensive yet simplified view of the data set for subsequent analysis. Now, at this point, our data is ready to be analyzed. And to do this, we're essentially going to split the data and run 2 series of models. In the first test, we're going to analyze the PCA reduced feature data using our classification models to establish a baseline of how well MRI features alone can predict survival outcomes and classify patients into risk categories. The second test, we're going to basically repeat the analysis, this time enriching the feature data with relevant clinical data. The expectations is the combination of feature data with pertinent clinical information may yield more accurate predictions, reflecting a more holistic view of each patient's condition. Now, for our models, we utilize 3 distinct machine learning algorithms: XGBoost, KNN classifier, and random forest classifier to predict survival outcomes in GBM patients. Now, each algorithm offers a unique approach to classification, providing a comprehensive analysis. We followed this up and implemented a grid search algorithm to optimize the hyperparameters of each classifier. Now, this process is critical for refining the models, ensuring that they perform at their best by fine-tuning the hyperparameters like learning rate, tree depth in the case of random forest, and neighbors count for cases like KNN. Now, as you can see in this before and after, the comparison clearly shows the effectiveness of hyperparameter optimization in improving both the accuracy and stability of KNN and random forest. XGBoost performance, because it doesn't have any hyperparameters, provides a valuable baseline for comparison, emphasizing the benefits and limitations of different modeling approaches in this context. Now, we included CAP and ROC curves to visually demonstrate the predictive efficacy of each model, highlighting their strengths and limitations in survival analysis. CAP curves are used to evaluate the predictive accuracy of a model, especially in binary classifications such as what we're doing. They help in understanding how well a model can separate different groups, for example, survival versus non-survival, which is the case of our study. ROC curves, however, provide a comprehensive measure of a model's performance across all classification thresholds by considering both the true positive rate and false positive rate. So up to this point, we were only modeling feature data. Incorporating clinical data alongside feature data dramatically improved prediction accuracies for all three classifiers. Now, this suggests a synergistic effect where the combination of different data types provides a more complete picture for each patient's condition. And as you can see from the ROC and CAP curves, everything is showing at 100% accuracy across the board. Having explored the insights gained from our classification models, let's now turn our attention to the Kaplan-Meier models, which will further highlight the survival probabilities and provide a deeper understanding of patient outcomes over time. Patients were divided into two groups based on the median survival days to assess the impact of the duration of survival post-diagnosis on their classification as either alive or dead. The L, or low risk, and H, high risk, curves represent patient groups stratified by the extracted features. The divergence of the curves indicates a distinct difference in the survival experiences of the two groups. The significant p-value suggests that the features extracted from the MRI scans are strong predictors of survival and can help in risk stratification. So to understand the graphs, the L group, or low risk, has a higher survival probability over time compared to the high risk group, with a notable separation between the curves that start to appear early and continues throughout the study period. And right here, we can see the survival predictions when you factor in the clinical information. And this small sample of just 31 patients, we were getting nearly 100% predictive accuracy in our models. So below the graph, if you notice, the number at risk is indicated at various time points, which basically represents the number of patients still at risk of death at that given time. It is common for this number to decrease over time, which is most likely due to reasons such as a patient's death. After delving into the survival analysis and its implications for patient care, we can now shift our focus to the broader impacts of our study, examining how our findings can resonate on a global scale, influence economic factors, and contribute to societal and environmental advancements. Now, in the case of global and societal impacts, we look at aspects such as enhanced diagnostic accuracy, where improved MRI analysis can lead to earlier and more accurate diagnoses, positively impacting patient survival rates worldwide. Additionally, radiomics can provide high-quality, affordable healthcare, particularly beneficial in low and middle-income countries where resources are scarce. Now, from an economic standpoint, there are a few positive implications, such as cost-effectiveness and resource allocation. Now, for cost-effectiveness, so standardized imaging protocols and machine learning tools in radiomics could reduce the cost for healthcare systems by streamlining diagnostics and treatment planning. Now, in terms of resource allocation, predictive analytics and radiomics can also shape the healthcare budgeting and resource planning, potentially leading to more efficient use of overall medical infrastructure. Now, that reduction in resource usage has positive environmental implications as well. New resource allocations could lead to new standardized protocols, which in turn, those new protocols could reduce the number of unnecessary imaging studies, which in turn minimizes the environmental impact of healthcare delivery. Overall, this study represents a significant stride towards integrating advanced machine learning techniques with traditional imaging modalities. The employment of radiomics to extract detailed features from MRI brain scans, complemented by clinical data, has not only demonstrated a potential to improve the accuracy of GBM prognosis, but also underscores the broader implications for personalized patient care. By pushing the boundaries of precision medicine, we open avenues for more targeted and economically viable treatment strategies, which could have a profound impact on global health systems, enhance patient outcomes, and pave the way for a more sustainable and equitable healthcare environment. Thank you for your time, and I hope you all have a very wonderful day.